There's three. Would you mind picking one of them? Which one would you like to ask?
I'd like to ask about tort reform.
Okay.
Why aren't we doing anything about tort reform in this particular bill or affordability?
Okay. What was the second part? I heard the tort reform. What was the second part? Portability. Portability. Oh, portability is in the bill. Portability is in the bill. In the Senate bill. Portability is in the Senate bill. And so that is covered. And let me talk about tort reform. You know, here in Missouri, we passed a massive tort reform bill. The legislature and the governor signed a massive tort reform bill in 2005. Today, we have a record low number of malpractice cases being filed in this state. Okay? Now, how many people have noticed their health care costs going down? Okay. The same thing in Texas, the same thing in California, the same thing in Florida. Now, and here's the other part about this that you need to understand. There is a very strong opinion in our Constitution, and one that I share, that there are certain things the federal government should do and there's certain things the federal government shouldn't do. For example, the Medicaid program, the federal government sends the money to Missouri, and Missouri decides the program. They decide here in Missouri who gets it and who doesn't. Same thing with the federal money on the highway funds. It comes to Missouri. They decide how to spend that money here in Missouri. I think that's good. I think it's also good that we respect the difference between state issues and federal issues. Medical malpractice cases are filed in state courts. They are not filed in federal courts. 98% of the medical malpractice cases are in state courts. The federal government has no business telling state courts what they should be doing. It is up to each individual state to tell their courts what they should do. And in Missouri, they have done medical malpractice reform. Florida, they did such a medical malpractice reform. Why, I might add, the people did it. It was an initiative petition. It was passed 4 or 5 years ago. And where we had this biggest increase in health insurance costs in the country, it has been Florida. No, per capita, sir. This is age and capita adjusted. I'm not talking about just because old people are in Florida. I'm talking about adjusted for age and per capita. And it's because that we are reimbursing people based on procedures, not on outcomes. Okay? It's not patient-centric. Have any of you ever had to arm wrestle your insurance company? Ever? Okay.